I will talk about session 11 to 14, and this would include the steps 5 to step 10 of the 10 steps of a successful breastfeeding practices. Session 11, we now go to step 5. Part of step 5, if the baby cannot feed at the breast. So the objectives of this session is to describe why hand expression is useful and how to hand express. Practice assisting to learn how to hand express. Third is outline the safe use of milk from another mother and explain how to cup feed an infant. So step 5 is to show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. So why might it be useful for a mother to know how to hand express? Why do we need to learn to hand express? So it may be useful to know how to hand express. First is for breast comfort, such as to relieve engorgement or a black duck, or simply to rub a few drops of hind milk on the nipple area to soothe if there is tenderness. Second, to encourage a baby to breastfeed. So you have to express milk on the nipple so that the baby can smell and taste it. Directly into the baby's mouth if the baby has a weak sac, or to soften the areola of a full breast so that the baby can attach. Also, to keep up the milk production when the baby is not suckling, or to increase milk production. Next is, we need to obtain milk if the baby is unable to breastfeed, or if the baby is small and tires quickly when the mother and baby separated, or to provide milk for a milk bank. Next, we hand express to pasteurize the milk for the baby as an option if the mother is HIV positive. Many mothers prefer hand expression to using a breast pump because hands are always with you and there are no parts to lose or break. Hand expression can be very effective and quick when the mother is experienced. Some mothers prefer the skin-to-skin stimulation from hand expression rather than the feel of a plastic and sound of a pump. Hand expression is usually gentle than pump, particularly if the mother's nipple is sore. There is less risk of cross-infection since the mother does not use equipment that may also be handled by others. So how to hand express? It is easier to learn to hand express when the breast is soft rather than engorged and tender. Here are the steps in order to hand express. First, we have to encourage the milk flow. So a mother can help her oxytocin reflex to work by first being relaxed or comfortable in a position. She may think of the baby or look at the baby or even at the photograph. So warming their breast and gently massaging or stroking the area. Gentle rolling on the nipple between her finger and thumb. Mothers can get their oxytocin reflex to work more easily with practice. When a mother is used to expressing her milk, she may not need to encourage the milk to flow. Second, she has to find the milk ducts. So ask the mother to gently feel the breast near the outer edge of the areola or about the length of her first thumb joint back from the nipple until she finds a place where the breast feels different. She may describe it as feeling like a knotted string or a row of peas. These are the ducts of milk. Depending on what part of the breast it is, the mother should place her first finger over the duct and her thumb on the opposite side of the breast, or her thumb on the duct and finger opposite. She can support her breast with the other fingers of the hand or with her other hand. Third, compress the breast over the ducts. Ask the mother to gently press her thumb and fingers slightly back towards the chest wall. Then she presses the thumb and first finger together, compressing the milk duct between ducts. This helps the milk to flow towards the nipple. She releases the pressure and repeats the compress and release movement until milk starts to drip out. Colostrum may come out in drops as it is thick and in small amount. Later, the milk may spray out in streams after the oxytocin reflex works. So, the third step would be compress and release over the ducts. Fourth, repeat in all parts of the breast. When the milk flow slows, the mother moves her thumb and finger around the edge of her areola to another section and repeats the press and release movement. When flow ceases, she changes to the other breast and repeats. If both breasts are to be expressed, the mother can pause to massage her breast again if needed. She can go back and forth between her breasts a few times if needed. So when to express breast milk? So these are the time or cases when to express breast milk. If the baby is not able to suckle, the mother can begin expressing her milk soon after delivery, about 6 hours preferably. How long to express breast milk? So the length of time to express milk depends on why the mother is expressing. First, if expression is to get colostrum for her baby who is not able to suck, she might express for about 5 to 10 minutes just to get a teaspoon of colostrum. Remember, the newborn baby's stomach is very small, and small amounts every 1 to 2 hours if what the baby needs. Next, if expression is used to increase milk production or aim to express for about 20 minutes, at least 6 or more times in 24 hours, including at least once at night, because your night feeding is very important in the milk production, so that the total time expressing is at least 100 minutes per 24 hours. So if the mother is just softening the areola to help the baby attach, she may only need to compress 3 to 4 times. If the mother is clearing a black duct, she compresses and massages until the lump has cleared. If it is past the newborn stage and the mother is expressing milk to be given to her baby when she is at work, determine the length of time to express by the flow of milk and the amount needed to meet the baby's needs. Some mothers can get the amount of milk needed in 15 minutes, and for some women, it may take about 30 minutes. A mother might express one breast and feed the baby from the other breast, so it would be depend. So, what are the points to remember or to take note? It is not necessary for health worker to touch the mother's breast when teaching hand expression. It may take a few tries before much milk is expressed. So more practice is needed. Encourage the mother not to give up if she gets little milk or no milk at the first try. The amount of milk obtained increases with practice. So explain to the mother that she should not squeeze the nipple itself. Pressing or pulling the nipple cannot express milk, but it would be painful and can damage the nipple. So explain to the mother that she should avoid sliding or rubbing her fingers along the breast when compressing, as this may damage her breast. With practice, it is possible for a mother to express both breasts at the same time. If a mother is both expressing and breastfeeding an older baby, suggest that she express first and then breastfeed her baby. The baby's able to get the fat-rich hind milk from deep in the breast more efficiently than expressing. Expressing milk should not be hurtful to the mother. If it does hurt, check the techniques and observe how the mother is expressing her milk. So, use of milk from another mother. If a baby cannot feed at the breast, the next best choice is to receive his or her own mother's milk. If the baby's own mother's milk is not available, milk from another mother is more suitable than milk from a cow, camel, or other animal, or milk from a plant, or the soy milk. When a woman breastfeeds a baby to whom she did not give birth, it is called wet nursing. So expressed milk from another mother is called donor milk. Some places may have breast milk banks to provide milk for babies who are preterm or ill. In a milk bank, the donor mothers are screened for HIV and other illnesses, and the milk is also pasteurized or heat-treated. Using donor bank milk is usually a short-term option as the supply may be limited. So, feeding expressed breast milk to the baby. Babies who are not fed at the breast can be fed by nasogastric or orogastric tube or using a syringe or dropper. You can use a spoon. You can do direct expression in the baby's mouth or you can do cup feeding. The need for alternative feeding methods and the most suitable method should be individually assessed for each mother and baby. Tube feeding is needed for babies who cannot suckle and swallow. A syringe or dropper can be used for very small amounts of milk, for example, colostrum. So place a very small amount, not more than 0.5 ml at a time, in a baby's cheek and let the baby swallow that before giving more. Spoon feeding is similar to syringe feeding in that very small amounts are given. The baby cannot control the flow, so there is a risk of aspiration if the milk is fed quickly. So, spoon feeding large amounts of milk takes a lot of time. This means the carer or baby may get tired before enough milk is given. If a large spoon is used, then this is similar to cup feeding. So what are the indications for cup feeding? So, in babies who are able to swallow but cannot suckle, cup feeding is indicated. So, in babies with difficulty in attachment, they may attach and suckle for a short time but tire quickly. And cup feeding is indicated in babies who are 30 to 32 weeks age of gestation wherein sucking is not yet developed. So what are the advantages of cup feeding over other methods of feeding? First, it is pleasant for the baby. There are no invasive tubes in his or her mouth. Next, it allows the baby to use his or her tongue and to learn tastes. Third, it stimulates the baby's digestion. Fourth, it encourages coordinated breathing, sucking, and swallowing. And fifth, the baby needs to be held close and eye contact is possible. It can also allow the baby to control the amount and the rate of feeding. A cup is easier to keep clean than a bottle and a teat. And it may be seen as a transitional method on the way to breastfeeding rather than as a failure of breastfeeding. However, there are also disadvantages of cup feeding, and these are the following. Milk can be wasted if the baby dribbles. Term babies can come to prefer the cup if they do not go to the breast regularly. Cup feeding may be used instead of direct breastfeeding because it is easier to do. So for example, a special care baby nurse may prefer to give a cup feed rather than bring the mother from the postnatal ward and help her to breastfeed her small baby. The amount the baby takes varies from feed to feed. This is true for any method of feeding. If a baby takes a small feed, offer the next feed a little earlier, especially if the baby shows signs of hunger. So measure the baby's intake over 24 hours, not feed by feed. Extra milk can be given by tube if the baby is too weak to take full cup feeds. If mothers are not used to cup feeding, they need information about it and they need to see their babies feeding by cup. The method needs to be taught in a way that gives them confidence to do it themselves. A cup does not need to be sterilized in the same way as a bottle and teat. It has an open, smooth surface that is easy to clean by washing it in hot soapy water. So avoid tight spouts, lids or rough surfaces where milk may stick and allow bacteria to grow. A baby can progress from tube feeding to cup feeding to fully feeding at the breast. The baby does not need to learn to feed from a bottle and teat as part of his or her development. In summary, it may be useful to know how to hand express for the breast comfort, helping a baby to breastfeed, keeping up the milk supply of mother. The more we express milk, the more milk production, obtaining milk if baby is unable to breastfeed where mother and baby are separated, or if milk is needed for another baby. So it is also useful because pasteurizing the milk for the baby as an option if the mother is HIV positive. So learn to hand express. These are the key steps in order to hand express. First, you encourage the milk flow. Next, you have to find the milk ducts. Third, you have to compress the breast over the ducts in a compressed and released manner, and then repeat that in all parts of the breast. The amount of milk obtained increases with practice. If a baby's own mother's milk is not available, milk from another mother who is HIV negative is more suitable than giving a cow's milk, a goat, camel, or milk from another animal, or milk from a plant source like the soy milk. Babies who are not fed at the breast can be fed by nasogastric or orogastric tube, by syringe or dropper, or giving it by spoon, direct expression in the baby's mouth, or you can give cup feeding. The need for alternative feeding methods and the most suitable method should be individualized for each mother and baby. Cup feeding can be used for babies who are able to swallow but cannot suckle well enough to feed themselves fully from the breast. So, a baby of 30 to 32 weeks gestation can often begin to take feeds from a cup. So, if a mother are not used to cup feeding, so they need more information and they need to see babies feeding by cup. So, meaning you have to show the mother how to do cup feeding, demonstrate it to the mother. The method needs to be taught in a way that gives them confidence to do it themselves. Your milk is very important to your baby, so it is useful to express your milk if your baby cannot feed at the breast, or the mother is away from the baby, or the mother wants drops of milk to encourage the baby to suck, or the mother's breasts are overfull or have a black duct, or The mother wants some hind milk to rub on the sore nipples and for some other reasons. You can help your milk flow by the following. First, by sitting comfortably, relaxed, and thinking about your baby. Next, you can warm your breast. Third is massage or stroke your breast and rolling your nipple between your fingers. And you can also have some back massage. Feel back from your nipple to find the place where your breast feels different. This may feel like nuts on a string or like peas in a pod. This is usually a good place to put pressure when expressing the milk. Put your thumb on one side of the breast and 2 to 3 fingers opposite. So compress the breast over the ducts. Try pressing your thumb and fingers back towards your chest and press your thumb and fingers towards each other, moving the milk towards the nipple. You release and repeat the pressure until the milk starts to come. Next, repeat in all parts of the breast. Move your fingers around the breast to compress different ducts. Move to the other breast when the milk starts to slow. Massage your breast occasionally as you move your hand around. If you are expressing to clear a blocked duct, you only need to express in the area where the duct is blocked. How often to express depends on the reason for expressing. So if your baby is very young and not feeding at the breast, you will need to express every 2 to 3 hours, being more frequent in this case. So it is important to have clean hands and clean containers for the milk when you do hand expression. So it is also important to discuss the milk storage if needed. These points are suggestions, not rules. So find what works best for you. Expressing should not hurt, and to ask for help if it does. And ask if you have any questions regarding on how to feed the baby. Why cup feeding is recommended? Because it is pleasant for the baby. There are no invasive tubes in his or her mouth. Next, it allows the baby to use his or her tongue and to learn tastes. It also stimulates the baby's digestion. It encourages coordinated breathing, sucking, and swallowing. The baby needs to be held close, and eye contact is possible. It also allows the baby to control the amount and rate of feeding. A cup is easier to keep clean than a bottle and teat. It may be seen as a transitional method on the way to breastfeeding rather than as a failure of breastfeeding. So, how to feed a baby by cup? Again, the mother should sit the baby upright or semi-upright on her lap. Support the baby's back, head, and neck. It helps to wrap the baby firmly with a cloth to help support his or her back and to keep his or her hands out of the way. So hold the cup of milk to the baby's lips. The cup rests lightly on the baby's lower lip and the edges of the cup touch the outer of the baby's upper lip. So tip or tilt the cup so that the milk just reaches the baby's lips. The baby becomes alert and opens his or her mouth and eyes. A preterm baby starts to take the milk into his or her mouth with his or her tongue. In a full-term or older baby sucks the milk, spilling some of it. And do not pour the milk into the baby's mouth. Just hold the cup to the baby's lips and let him or her take it himself or herself. When the baby has had enough, the baby closes his or her mouth and will not take any more. If the baby has not taken the calculated amount, He or she may take more next time, or you may need to feed the baby more often. Measure the baby's intake over 24 hours, not just at each feed. The use of milk from another mother is what we call wet nursing, and the following are the circumstances where we can use wet nursing. If the mother dies or is very ill, or if the mother will be away from the baby for a long period of time, or if the mother is HIV positive. So before we do wet nursing, we have to reduce the risk of the baby acquiring HIV. The wet nurse needs to be counseled, tested, and shown to be HIV negative. The wet nurse, if sexually active, also needs to be counseled after safer sex practices so that she does not acquire the virus during the breastfeeding support and assistance to establish good breastfeeding. It is important for the mother to stay close to the baby and to care for him or her as much as possible so that she bonds her baby. Second, donor milk and heat-treated milk. Heat treating destroys the HIV in the breast milk. A mother who is HIV positive can also heat treat her milk at home to reduce the risk of transmitting HIV to her baby. Breast milk should not be heat treated unless necessary. Breast milk from an HIV negative or untested mother does not need to be heat treated if the milk is for her own baby. Heating reduces some anti-infective components of breast milk and enzymes in milk, but remains superior to breast milk substitutes. Do not heat treat the baby's own mother's milk just in case that the mother is HIV positive. Tube feeding. Fat can stick to the side of the tube, thus reducing the energy level of the feed received. If breast milk is fed continuously, angle the milk container and place the outlet tube at the highest point in the container so that the creamy part of the milk is fed first. So, bottle artificial teats come in a wide variety of sizes and shapes. There is not one teat that is best or most like a mother's breast. Babies who use the bottle and teat method may lose interest in breastfeeding. A baby can progress from tube feeding to cup feeding to fully feeding at the breast. The baby does not need to learn to feed from a bottle and teat as part of his or her development. Clean water and extra fuel are not always available to clean bottles and teats. This places the baby's health at risk. If a mother plans to use bottles and teats, then the mother must be instructed on the health and safety issues associated with their use. A breastfeeding supplementer can be useful to ensure that the baby receives enough milk while encouraging the baby to suckle for longer, or if the baby has a weak suck. To use a nursing supplementer, the baby must be able to attach to the breast and suckle. A breastfeeding supplementer is a device to allow extra milk to be given while baby is at the breast, thus stimulating milk production, encouraging suckling, and enabling closeness of mother and baby. If the baby cannot attach to the breast and suckle, this method cannot be used. A breastfeeding supplementer device can be purchased or homemade. So, to use a homemade supplementer, the supplement is put into a cup, and a fine tube passes from the cup along the mother's breast to the baby's mouth. As the baby suckles on the breast, the baby draws the supplement through the tube. The tube of the supplementer needs to be thoroughly rinsed with water immediately after use. sterilized each time it is used, especially if the baby is ill or perturbed, or rinsed and then washed well in very hot soapy water for an older healthy baby. Breast pumps are not always practical, affordable, or available, so it is preferable for mothers to learn how to express by hand. If breast pumps are available to mothers in your area, and if a particular mother needs to use one, help her to choose an effective pump. Show her how to use the pump and go through the manufacturer's instructions with her. It is usually helpful to stimulate the oxytocin reflex before pumping by sitting comfortably with support for the back and the arm holding the pump, relaxing, massage, and other techniques as described for hand expressing. So what are the checklists for choosing a pump or the consideration if you will use a pump? First, you have to ask, does the mother find it works well? Second, is it easily available at an affordable price? Or is it comfortable to use? Like having the arm position, the weight, the adjustable suction? Is the size of the breast cup, funnel, and insert, if available, is suitable for the size of the nipple and breast? Can the milk be stored in a collection container, in standard thread containers, or is there a need to purchase special containers? So what is the noise level when in use? Or is it safe to use and easy to clean and sterilize? Is it easy to assemble with few parts? Are there clear instructions for use? So those are the considerations before using a pump. So how do we store expressed breast milk? Choose a suitable container made of a glass or plastic that can be kept covered. Clean it by washing in hot soapy water and rinsing in hot clear water. If the mother is hand expressing, she can express directly into the container. But make sure that the hands are clean. If storing several containers, each container should be labeled with the date. Use the oldest milk first. The baby should consume expressed milk as soon as possible after expression. Feeding of fresh milk rather frozen is encouraged. So how do we store fresh breast milk? Frozen breast milk may be thawed slowly in a refrigerator and used within 24 hours. It can be defrosted by standing in a jug of warm water and used within 1 hour as it is warm. Do not boil or heat it in a microwave, as this will destroy some of the breast milk's properties and can burn the baby's mouth. So here is the storage of breast milk. For fresh milk or freshly expressed milk, you can store this at 25 to 37 degrees for 4 hours or at 15 to 25 degrees for 8 hours. If the temperature is below 15 degrees centigrade, you can store it for 24 hours. So milk should not be stored above 37 degrees centigrade. For refrigerated expressed milk or temperature of 2 to 4 degrees centigrade, you can use it up to 8 days. So place the container of milk in the coldest part of the refrigerator or freezer. A mother may prefer to use milk within 3 to 5 days or fresh milk that will not be used within 5 days if she has a freezer. So for frozen milk, freezer compartment inside the refrigerator, it can be stored for 2 weeks. If you have a freezer part of a refrigerator and put it in a freezer, it can be stored for 3 months. If you have a separate deep freeze, The milk can be stored for 6 months. Thawed in a refrigerator, it would only last for 24 hours. So, this milk should be given to the infant as soon as possible after thawing. Do not refreeze thawed expressed milk or place the container in warm water to thaw quickly.